So one thing I want you to think about is when you're sitting is that you don't necessarily have to be doing squats or moving the cable. You can be doing some seated exercises to really work that spine. So what's nice is that his feet are at the bottom edge, and if I bring the incline up, as we talked about earlier, I accommodate for some hamstring flexibility. It does require the person on the board to hold that board up, so it does require some core stabilization. One of the exercises that's really nice is hip hinging. So that's a nice, great way to work the back. And you're just basically going to hinge forward from the hips and then back. The range of motion isn't necessarily very large, and sometimes I work with people on this exercise just so they understand the aspect of can they move from their hip and not necessarily from their mid-back or flexing and rounding from that lumbar spine. If I'm noticing that there's barely any movement and they're not really feeling it, there are two options. First option might be to put their feet on the floor and then stand up a little bit and let the glide board come all the way down the rails. And now they're straddling, and then they can move again into that hinging position. I have now taken out necessarily the hamstrings, but you're going to put your feet on the floor to either side, and you can go through that hip hinging action. You can add that long lever with the arms, where the arms can be reaching overhead. If they say, oh, this feels pretty easy, I can then open up the board and have them keep the board open and try to stabilize the board that way as they're hinging. Another way to tweak this exercise can be as simply as now putting your feet back to the struts. If that again is too easy and maybe they're very flexible, maybe you walk their feet up to more of the squat stance. So you're taking this one exercise, and you can see how you can really take a patient that might need a lot of progressions, or rather regressions, and you can take that person who's really progressing and keep making it harder and harder and harder. So with hip hinging, a nice natural way into an exercise is a roll up. So I'm going to have you push the glide board up the rails, and then you can go into a roll up and then a roll down. One of the things I wanted to highlight, as we mentioned earlier, was the fact that you can really cue the movement of the glide board. You can really build in that proprioceptive awareness that movement begins with the initiation of the pelvis. And that's what sometimes I necessarily really want the person to start to understand, because they oftentimes are guarding there. And not that I want to encourage more spinal flexion, but I do want them to encourage more mobility within that spine. The lower you go with this exercise, the harder it becomes. To add on to this exercise, I can even have someone just roll a little bit back and be adding tosses to them. I can be having them throw a ball as they come up. You can keep thinking, how many ways can you progress it or tweak it to meet your patient's needs?